Social Security Disability, Qualifying for Benefits, with PACER's Project Launch and Minnesota Disability Determination Services. Today our speakers are Sarah and Tanya, who are Medical Relations Officers from the Minnesota Disability Determination Services.
I am Sarah Dix. I'm joined by Tanya, who had a couple technical difficulties, but she is here. She's just off screen, but she will be joining me. As Judy said, we are medical relations officers from Minnesota Disability Determination Services, and we're here to talk about Social Security disability and qualifying for benefits. So I'm going to cover what goes into our decision-making process, the life of a claim, things that you can do to help make sure that your claim is effective and efficiently reviewed. And then we will have plenty of time for questions. So as I mentioned, we are from Minnesota Disability Determination Services. Each state has at least one DDS office, and it's operated by that state's government, but it's 100% federally funded and does 100% federal work. So we work in close partnership with the Social Security Administration in order to make the medical determination on eligibility for federal benefits for disability. The field offices are the all federal component. There's a whole bunch of them scattered across the state, and you might go to them to get a Social Security card replacement, for retirement, for other survivor benefits. They handle a whole host of things, especially dealing with technical details and money that we don't necessarily handle or know the answers to. But like I said, any questions that you have, Tanya and I will do our best to answer. However, our focus is on the medical determination for eligibility. When we talk kind of in everyday, what is a disability, that meaning is a little bit different from the disability definition that's used by maybe your employer, short-term disability, from county or state benefits, from the VA. Everything is a little bit different. For Social Security, we have a very specific definition, and a person is disabled when he or she has severe medically determinable impairments. They can be physical or mental, and those impairments prevent him or her from performing substantial gainful activity that is work that earns an income, and that impairment has lasted or is expected to last 12 consecutive months or result in death. So there's three key components. You have to have a physical or mental condition, it has to stop you from working, and it has to be long lasting. For children, we have a very similar definition, but children don't typically work, so we take out that component. For kids, we say that they're disabled when they have that severe medically determinable impairment, and it has to last 12 consecutive months and result in death. But instead of taking in that substantial gainful activity consideration, we say that they have marked and severe functional limitations. Instead of going to a job, kids can't do the job of being a kid. So that is how we're looking at disability definitions for Social Security purposes. Within SSA, there are two main disability programs. The first is Social Security Disability Insurance, which is usually called SSDI, but I've also seen it referred to as SSD and RSDI. Government programs are just an alphabet soup of abbreviations and acronyms. So I'll try to remember calling it SSDI consistently, but in general, those are the most common acronyms that I've seen for this one program. These are benefits for disabled people who have a work history. So an adult, someone over 18 who has gone to work and earned an income. However, there are some benefits that can be paid out based on earnings on another person's profile. For SSDI benefits, whenever you work, you pay taxes, and you'll see on your paycheck that something is taken out for Social Security, and that's where that money comes from. So for a young adult between age 18 and 22, if they also have a parent who is retired, deceased, or disabled, and that parent has paid into Social Security taxes, that young adult may be eligible to pull benefits based on their parents' earnings. The other program is Supplemental Security Income. And this is usually known as SSI, sometimes SS. And these are benefits for disabled people who have limited assets and resources, as well as children in low-income families. almost all kids claims, people under 18, are processed through SSI. When we talk about limited assets and resources, there are a lot of different calculations that go into this. The field office is the expert in this area, but kind of a good general ballpark or rule of thumb is for someone over age 18 who's unmarried, that would be $2,000 in available income and assets. So that would be money in the bank or things that you could easily sell to get money. Social Security doesn't count the house that you live in, and they don't count one vehicle. However, if you have more than $2,000, maybe you have some investments or retirement savings, or you have an ATV or a lake house, those are things that Social Security is going to count to determine what your assets and resources are. For children, the math is way more complicated, and I can't give you a very distinct definition of how they decide this. There are lots of different factors like the size of the family, how many people within the family are working, whether there's earned income or income from state and federal services, that kind of thing. But just sort of a general ballpark for a two-parent family with one child and that child has a disability, if both parents are working and earning an income, they'd be looking at $4,000 a month or so to help determine whether or not that child is going to qualify for SSI. Whether the program is SSDI or SSI, our medical requirements and the evaluation process is the same. Whenever you're applying, the field office is going to figure out whether you're eligible for SSDI, SSI, or both of them, which is also an option. Then when we look at it, we're going through the same series of questions. The process is very similar. The main difference is where the money comes from. Like I said, if you've paid into taxes or not, when you receive payments, and it can affect the benefit amount. But in general, the process is the same. It doesn't necessarily matter whether you apply for SSDI or SSI. That's because no matter what kind of claim it is, we use the same process to work through and ask ourselves, does this person meet the definition of disability according to SSA? On the screen, I have a flow chart of Social Security's sequential evaluation process. And this is the series of questions we ask ourselves as we work through every single adult claim to figure out whether or not we can approve this person to receive benefits. Kids is a little different, I'll get there in a second, but for adults, we first ask, is the person working SGA, substantial gainful activity? That's part of the definition. Substantial gainful activity is a dollar amount that changes every year based on the economy. And in 2022, that dollar amount is $1,350. If you are working and you're earning more than that, we know right away that you are not going to be disabled. According to the federal government, that is enough money to cover your very basic living needs, and you are able to work at least that much. And clearly, according to Social Security, you do not meet the definition. If you are not working, or you're working but earning less than the $1,350, we move on to step 2, where we ask, does the person have a severe impairment? It kind of sounds like government doublespeak, but when we say a severe impairment, it means that it has more than minimal effect on your day-to-day life. So if you have a vision impairment, for example, but it's easily corrected with putting on a pair of glasses, that's probably not a severe impairment. Something where you take a pill with no side effects, probably not a severe impairment. If there's no severe impairment, we deny the claim. A severe impairment is going to have impact on your day-to-day activities. You might need to make modifications, make some plans for how you're going to do things. And if you do have that severe impairment, we move on to step 3. We ask if the impairment meets the listings. I'll go through the listings in a little bit more detail in just a minute, but basically the listings are certain criteria that mean the impairment is so severe, we know right away this person is disabled, and we know that there's no opportunity for them to reasonably work for the standard American 40-hour work week without major interruptions. The listings are indicative of very severe impairments and very limited functional ability. So fortunately, most people do not meet the listings. When you don't meet the listings, we write what's called a residual functional capacity, or RFC, and that is a medical assessment saying, we understand you have impairments and limitations. What are you able to do despite those impairments? So we might ask ourselves, in a typical 8-hour workday, how much can this person stand, sit, or walk? Could they lift something that weighs 10 pounds or 20 pounds or 50 pounds? For someone who has a mental impairment, we might ask things like, can this person accept criticism? Can they focus on a task for extended periods of time? Are they able to maintain standards of hygiene and appearance that are kind of societal norms? So those are the things that go into the RFC. Once we have the RFC, we look at past work that the person has done, and we see whether or not that person is likely to be able to do similar work again, even though we know that they have these impairments. If it seems reasonable that that person might adjust to that same job, we deny the claim. However, if we look at work that you've already done and we say, we don't think that you could really adjust to doing that again, we move on to the fifth and final step where we ask, does the impairment allow for any work? Any work really means any work. Social Security, unfortunately, doesn't really care if it is a job that the person would like or wants to do. They don't really care if it pays as much as you would like to earn, as long as it pays at least substantial gainful activity. And it doesn't necessarily have to be local to you, as long as it's a job that exists in substantial numbers across the country. So it might not be in St. Paul, but if it's in Des Moines, Iowa, that's great for Social Security. However, if we can't find any job that we think that a person is able to adjust to despite their impairments, that's where we approve at step 5. So quick recap, there are 2 places where we know someone is going to qualify medically for disability benefits at step 3 because their impairments are so severe that there's no expectation this person could work, or at step 5, where we are unable to identify any job that this person can reasonably sustain for 40 hours of the American work week. So as I mentioned, kids' process is a little bit different. We take out steps 4 and 5 because, as I mentioned, kids don't usually work. So we follow everything the same through step 3, where we're looking at the listings. If the child doesn't meet the listings, we then review a childhood disability evaluation. We go through these 6 domains and we ask, how does this child function compared to non-impaired peers? And we use a rubric to help determine whether or not the child is disabled. So the 6 domains are acquiring and using information, attending and completing tasks, interacting and relating with others, moving about and manipulating objects, caring for self, and health and physical well-being. Within each of these domains, the rubric will show there's no functional impairment to there's extreme functional impairment. And for a child to be considered disabled, we have to find 2 areas, 2 domains where there's marked impairment or one where there's extreme impairment. So those listings I keep mentioning. All of our listings are organized in something called the Blue Book, because before the age of the internet, this information was organized in a book that was blue. If you just Google SSA Blue Book, you'll find it right away, but I also have the link here. It's ssa.gov/disability/professionals/Blue Book. There you'll see different body systems, and within each body system, we have the criteria that make each impairment so severe that we know that they're going to prevent work for adults or result in those marked and severe functional impairments for children, meaning the person is clearly disabled. You can see on the left, I apologize because I'm sure it's really small, but we have the listing of impairments for adults in the background and listing of impairments for children in the foreground. The categories of body systems are almost the same. There's one difference for children. There's low birth weight and failure to thrive, which does not exist for adults, but otherwise they're the same. The body systems and the impairments between children and adults are really, really similar. However, for some things that are specific to kids or that are dependent on age or development, that's where you'll see the differences. Within each body system, we've got the impairments, and each impairment shows specific evidentiary requirements and considerations that we have to look through and use when we're determining whether or not those listings are met. I apologize again for tripping over my words. Other things that are included are time periods that we're looking for the impairment to be impacting the person, or time periods where we're able to pay disability benefits based on the impairment. I've got here the Social Security autism listing. This is one that is the same for adults and children. We typically see within the body system the various impairments, and then each impairment will have sort of a definition or what we're looking for, and then the actual listing itself that shows the criteria that we're reviewing to determine if the person is disabled. So as I said, autism is the same for adults and children, and Social Security is defining the issue as characterized by qualitative deficits in the development of social interaction, communication skills, symbolic or imaginative play. There are restrictive, repetitive, and stereotype patterns of behavior, interests, and activities, stagnation of development or loss of acquired skills, and signs and symptoms may include, but are not limited to, abnormalities and unevenness in the development of cognitive skills, unusual responses to stimuli, and behavioral difficulties, including hyperactivity, short attention span, impulsivity, aggressiveness, or self-injurious actions. The actual listing says that with this in mind, we have to have medical documentation of both of the following. There have to be those qualitative deficits in verbal and nonverbal communication, social interactions, and significantly restricted repetitive patterns of behavior, interests, or activities. And in addition to that, we need to see evidence that there is extreme limitation of one or marked limitation of two of the following areas: understanding, remembering, or applying information, interacting with others, concentrating, persisting, or maintaining pace, or adapting and managing oneself. So you can see that there's a lot that goes into this one listing for autism. We have multiple points that we have to meet. So that's why I recommend, if you are thinking about applying for Social Security, definitely just do that SSA Blue Book in your search bar and check out the impairments that are relevant to you to sort of understand what criteria and what features we're looking at as we review the claim. Whenever you are ready to apply, there's a couple ways to do it. You can start online at ssa.gov/disability. This is my preference. I'm a millennial. I'm all about computer stuff. I like being on the website because I can browse around and get a lot of my answers to my questions on the website, get some extra factoids, things like that. But the great thing about the online application process is that it is tailored to work at your speed. If you want to sign in and complete the entire application in an afternoon, wonderful. If you need to sign in and you're overwhelmed by the questions that they're asking, maybe you need to do a little research to get some of this information gathered, that's cool. You can come back a day or a week or a month later, and it's going to be ready and waiting for you to pick up where you left off. The other option is calling SSA toll-free at 1-800-772-1213. The great thing about calling on the phone is that you're going to have a real live person on the other end, and that person can answer questions that are specific to you and your situation. The downside is it is a national hotline number, so you will need to dedicate some time to being attached to your phone. You might be on hold. I have heard that they do have that callback feature where the phone like holds your place in line and then they call back whenever someone is ready to talk with you. But that just, like I said, means you're sort of tethered to your phone until that call comes through. You may have to do a couple different interviews by phone to make sure that the field office has all the information that they need. But either way, that is going to get your application into us in a timely manner. I do recommend as soon as you think that you want to apply for benefits, get the ball rolling, because the very first day that you start your application online or the very first time that you call that toll-free number is going to lock in what we call a filing date. For SSI claims, the ones with kids or limited resources, that is a really important date because it establishes the very earliest date that we can start benefits from. So if you call on February 1st, but your complete application isn't submitted until June 1st, you are still eligible to get benefits all the way back to February 1st. Right now, our in-person services at the field offices are suspended due to the COVID pandemic. However, there are certain exceptions. I would keep an eye on the news as I do understand they're working on reopening plans, but for the time being, online and by phone are your best options. Things that you want to make sure that you have available right away are the personal information for the applicant or yourself if you're applying on behalf of someone. So that would include stuff like your name, social security number, family data, financial info if you get benefits, where should we send money. We'll want medical information like the names of the doctors, hospitals, and clinics you've gone to recently. For adults, we look for vocational information, and for children, we look for school information. If you are applying, and especially online, I recommend checking out these disability starter kits. They are available for free on the website. If you go to ssa.gov/disability, on the left-hand side, there's a bar that says apply for benefits. Click on that and then click on disability starter kits. They're going to help you prepare all of the information that you're going to need for your application. There's a fact sheet, a checklist, and a worksheet, and it should answer a lot of questions and help make sure that you're fully prepared when you start the application. I have a image of the adult form here on the slide if you can see it. There is a different version for kids, and then there's also English and Spanish versions, but it covers information that I necessarily might not think of. If you have minor children or a spouse, you also need their names and dates of birth. You have to have your dates of marriage and divorce. Make sure that you have your bank's 9-digit routing number. This is stuff I personally would have to maybe go and double check and make sure that this information is ready and correct on my application. Whenever everything is gathered, you've done everything you can, you submit your application, and the federal field office takes over and they make sure that everything looks accurate and complete. Once they've made sure all the I's are dotted, T's are crossed, they send the application to my office at the DDS. Then the claim is assigned to an examiner. In most cases, there's one examiner who works on the case from beginning to end. So by the end of things, they are going to know that case really, really well. They should have a good understanding of what is going on with the person's impairments, know who to contact, and have a really good understanding of how things are working. So that person basically is a personal expert on you. Whenever they're starting, they go and they request medical records from all the sources on the application, all the doctors, hospitals, and clinics that you visited. And then they also send out a couple of packets of questionnaires to the family. This will include a function report, and for adults, it may include a work history report if the person has ever had work activity. And then we usually request collateral information, and that might be from school, from a job, or another third party, another person in the applicant's life if we need it. We want to make sure that we have a really thorough understanding of what is going on with this person, their impairments, their limitations. And we really work hard to make sure that we're not making assumptions and that every decision is based on evidence that we can see in front of us. For that reason, if we have any questions about what's going on in the claim, we might order what's called a consultative exam, or CE. These come up probably about a quarter to a third of claims, so they're pretty common. And it is a one-time exam with a professional in different areas. So we have doctors, we have pediatricians, we've got psychologists, speech pathologists, eye doctors, ear doctors. We've got a little bit of everything for whatever the impairment may be, that if we have a question, we can set up this consultative exam and get answers to fill in any blanks. The consultative exam is free. We set it up, we organize it, and the applicant's only responsibility is to get to the CE on time and make sure to put in your best effort while you're there. After that, the CE panelist or doctor has 10 days to submit a report to us, and we carry on with the claim with that information that they were able to get from the exam. We are always looking for a few key factors when we're looking at the evidence in a file. First of all, we want recent information. We limit information to kind of a relevant time period, which is usually 1 year before the person filed the application or the disability began, and it goes up to the time of decision. We don't typically look for information from your whole life because with the thousands and thousands of claims that we review, that would end up taking a very long time. So we try to keep really focused on how your function is working right now. We also want information that's relevant to you and your impairments. If you have a mental health concern, we would like to see evidence from a mental health practitioner. And then finally, we also want information that's consistent across sources. If Dr. A says something completely different from Dr. B, and that information doesn't quite match up with what you listed on your application or your claimant forms, we've got questions. For all of these, if there's any area that's lacking, that's another key reason that we order a consultative exam. It is super realistic. People don't have insurance and they don't go to the doctor. I personally have had like one doctor visit since the entire pandemic began because I don't want to go out in public and do that. So that is a very real thing that comes up regularly. We might order a consultative exam for that. A lot of people don't have care from a specialist, and that is okay. That is not a problem. But again, might be a reason that we try to get a consultative exam. And then finally, with the consistency issue, if we've got different information from different sources, we'll get another party to weigh in and give us some information to kind of connect the dots and figure out why Dr. A and Dr. B don't agree. And then finally, information that we're looking for should come from what we call acceptable medical sources. And these have to be findings from an exam, not just a diagnosis. So we have to see why the diagnosis is applied. Acceptable medical source kind of sounds like a mean name because all sources of information are really important. But AMS providers, acceptable medical sources, have more consistent licensing rules across the country. And since SSA is a federal program, they want to make sure that things are as even as possible, whether you're in Minnesota or Michigan or Maine. So our AMS providers are doctors, psychologists, nurse practitioners and physician's assistants, speech pathologists, eye doctors, and ear doctors. Non-AMS sources are super duper common. Their evidence is extremely valuable. However, this might be another case where we order a consultative exam, even though you have recent information from a relevant source that is consistent. Therapists, counselors, social workers often are the key provider for a mental health impairment, but it's just sort of a government red tape thing that we have to have that diagnosis from one of these AMS providers. So if you know that you or your family member has been going to therapy with one of these providers and we ask for a consultative exam, we're just dotting I's and crossing T's. Another source that is in here that is non-AMS is school personnel. However, we rely on school evaluations and IEPs whenever they're available. They are so full of wonderful information, like I can't gush about them enough. They give us a really, really good understanding of what is going on with the child in multiple areas of life and their schoolwork. There's typically qualitative assessments like IQ testing, achievement tests at school. There's observations from different teachers and the kinds of um, program and accommodations that help the child succeed best in school. So they are crazy important to us. And we typically request them even for young adults up to age 25 if we think that the school evaluation is going to be available. And then finally, we also look for a function report. It is critical. As I mentioned, with the examiner taking the case, they typically send out a couple forms, and this is one of them. We rely on this form so much that it is required for adult mental health conditions. If you don't send us this form, we're going to have problems. There are different versions for adults and children. And for children, there are age-specific forms based on sort of different developmental stages. And there's also a third-party form, a collateral form, that can be filled out if the disabled person isn't able to complete the form accurately themselves. These forums cover everyday activities and your limitations, and they discuss things that aren't usually in medical records. My doctor has never asked me how many hours I spend cooking and cleaning a week, but that is something that I have to do every single day. The form is going to ask questions about your hobbies, how much you socialize, with whom, how do you do it, how often do you go outside of your house? Do you ride in a car? Do you drive a car? Do you take a bus, etc.? So it gives us a really good perspective on what the person's actual everyday life is like. And the great thing about this form is that you control what is on it. You are the person filling it out, so you get to highlight the things that are most important or critical to you or your situation. And if there's stuff that you're not worried about, you can leave that off too. This form, like I said, is so important that in the past, for PACER, we've even done an entire presentation on completing the adult version of this form. So make sure whenever you are applying, you're keeping an eye out for this. You are filling it out to the very best of your ability and returning it on time so that we don't have delays in your claim or that we don't have to deny the claim for insufficient evidence because we did not get this incredibly important form. So I talked about all of the evidence that we get. Once everything is in file, the examiner knows everything about the person. They've collected the information, organized it, annotated. They share the case with a state agency medical consultant, and that's going to be a doctor or psychologist who works in our office. We have speech pathologist as well. They review all of the evidence and they write those medical assessments. So they're checking if the person meets the listing at step 3, and if not, they're writing that residual functional capacity, what the person can do despite their limitations. After that, the medical consultant shares the claim with the examiner again. For adults, the examiner does a vocational assessment. So that's those steps 4 and 5, if you can adjust to work you used to do or if you can adjust to another job. And that typically is going to be dependent on the person's age, education, past work, and transferable skills. And then for kids, we go through that childhood disability evaluation where we're using the rubric compared to non-impaired peers looking for those 2 marked or 1 extreme limitation areas. Once the decision is made, DDS transfers the claim back to the federal field office, and they're the ones who make, they have the final say. They go through all the technical details and they're able to tell you whether or not your application for benefits was approved. If the decision is favorable, they will start benefits and be in contact for how you would receive that money. If the decision is not favorable, you were denied, all applicants have the option to appeal within 60 days, and that is the magic number. If you are outside of that 60 days, they will ask you to start over again. The appeals process starts with reconsideration at DDS, where the appeal decision is reviewed by a new examiner and a new medical consultant. They go through all of the information that was gathered on the initial part of the claim. They get any new records, they look for updates, and then they re-review everything sort of with fresh eyes. The appeals process is really important because this gives you the opportunity to correct any missing information. The two biggies are someone who didn't send in their function report, or someone who had a CE appointment scheduled but did not attend for whatever reason. When I say these things are important, I really mean it, because this can be a reason that we deny a claim. However, reconsideration does afford you the opportunity to try again. And ultimately, about 12% of claims are changed from a denial to an approval when someone appeals. If you are denied again, you have the opportunity to go before an administrative law judge, and it's like a court hearing. A lot of people get a lawyer, although I don't think it's specifically required, but you bring your evidence, you can call witnesses, and you make your case for why you are eligible for Social Security disability benefits. There are in-person and virtual hearings available. Pre-pandemic, I was a big proponent of the virtual hearings because you get scheduled a little bit faster. There are not that many administrative law judges in each state, so the waiting time can be a little bit longer. But if you are able to do a virtual hearing, which I think most people are a little more comfortable in the virtual world after the past 2 years, that is a really good opportunity. Judges take information into consideration the same way, whether you're in person or virtual. So I just want to mention that. And then I also just want to take the opportunity to bust a few myths that Tanya and I hear really regularly. And those include things like all claims are denied on the first time, or you have to apply a certain number of times before you're approved. And that is just not true. We look at every single claim based on its own merits, the own facts and evidence that is available to us, and make a decision using sequential evaluation for every claim. There's very little use for us, I guess, for prior claims. We'll check them out for additional evidence, or make sure that there's no technical detail that we're overlooking, but it doesn't matter if you've applied 1 time or 2 times or 7 times or 72 times. We do look at each case on its own merits. Whenever someone is allowed, you're not done with us. There's something called continuing disability review, which is required by federal law, that we check in every so often to make sure that the person is still eligible for Social Security benefits. Whenever we approve a claim, we set what's called a diary, and that is an indicator for when we should check in based on how likely we think there will be improvement in your impairments. Some conditions are generally fairly treatable. So for example, someone with cancer, we might set a shorter diary, maybe just a year or 18 months before we check in, because we know with treatment, there's a good likelihood the person will go into remission or have improvement, maybe go back to work. For other conditions, say autism or Down syndrome, we know that that is lifelong, and maybe there might be some adaptations or new skills that a person learns. At the end of the day, they are still going to have autism and Down syndrome, and they're unlikely to have a major change in their ability to work and function. So for those, we check in a lot less often, maybe like once every 7 to 10 years. Whenever the CDR review comes up, the claim is automatically selected by the field office and transferred back to us at DDS. You don't have to do anything to let us know you think it's time for us to check in. We take care of everything on our end. We'll notify you when your CDR has come up, just so that you're aware and expecting information from our offices. When we have the CDR claim, there are special CDR examiners who look at all of the information from when we first approved the person and how they're doing now, and they check if there's been any medical improvement related to the ability to work for adults or function compared to non-impaired peers for children. This also has an appeals process. It's very similar to initial claims. You can ask for reconsideration at DDS. You can go before a hearings officer, and actually both levels of appeal can go all the way up to the Supreme Court if you're determined enough. So there are lots of options to make sure that if you are eligible for benefits, you get on them and you stay on them. And I know that this should be an important topic to some of us here in the audience today. When a child turns 18, there are a few special factors. The first is that when a child is under 18, Social Security looks at the family's income and assets to determine whether or not that person is financially eligible for benefits. However, when a child turns 18, they are considered independent of their parents' income. And I don't know about you, but when I was 18, I did not have $2,000 in the bank. So it can make a major difference in terms of whether or not someone is eligible for SSI benefits. The other thing is for kids who are already on benefits as a child. When the child turns 18, we have to check in and make sure that the person is still eligible under the adult rules of disability. If you remember when I said there's an adult listing, there's a child listing, they're mostly the same, but they're a little bit different. That's sort of where that comes into play. If a child is discontinued from benefits at age 18, they no longer meet the requirements as an adult, there are certain educational and vocational programs that exist, and they can extend payments all the way up until age 22. So that would be things like a transitions program after high school, or going into a vocational or job coaching program. Those are things that Social Security finds are valuable uses of the person's time, allows them to develop further skills, and that's why some benefits are able to continue. So I have talked about all the things that go into an application, and I'm going to turn things a little bit onto you for things that you can do to make sure that an application is received and able to be processed efficiently. First and foremost, it seems obvious, but you wouldn't believe the problems we have. Make sure that you have full and alternate names of the disabled person on the application. A lot of people, maybe you're born as Robert, but you go by Bobby. That can cause hiccups. And we very regularly see a baby is born in a hospital and registered under one name, but the child's name is then changed, something different on the birth certificate or whatever the case may be, and we need to know about all of those names. We regularly have problems, especially with some of the pediatric medical vendors in the area, because that does come up really often, and they need help to identify who the person is and make sure that they are releasing the right records. Similarly, if there are guardianship papers involved for an adult child who is still under your guardianship, or if there's a foster situation, adoption, whatever the case may be, please send them in with your application. If we go about requesting medical records, but we find all of them are coming back without a response, usually the hospital or clinic will say, well, we don't know why this person signed the medical release form, or we know that little Bobby Smith signed the form, but he has a guardian, so this is not legally okay. Then we have to take the claim, call you, you have to look for the forms, you have to send them in, we have to add them to the file, we have to re-request the records, and then finally get them. And this can add up to weeks of delay while we process your claim. So if this is something already in your possession, please, please, please send it in at the time of your application. I did mention how important school information is. School evaluations and IEPs are our main thing we're looking at for a lot of young people. So if you have that in your possession, it is a great idea to send them in at the time of application. In general, school staff can be stretched pretty thin, but never more so than I think in the past 2 years. Every time I look at the news, there's a story about how schools are understaffed, how teachers are missing time, things like that. So that can be a great way to make sure we have the evidence we need if you send those forms in at the time of application. We also ask for highly relevant medical records if you have them. Don't go out of your way to get them because we will request them. But if you have them at home, it doesn't hurt to send in things like diagnostic assessments, psychological testing, or specialized medical records like from an oncologist or a geneticist. There's a few reasons that these can be really helpful to us. For SSI claims for kids and people with low income, we are able to do something called presumptive disability determinations, where basically we get some piece of evidence, we look at it and we say, this is probably going to end up as an approval at the end of the day. We start benefits right away. We might still need further information in the claim to make sure everything is fully documented and we've got all of our information covered, but you can still get money while we're doing that. So it is really important if you have that information, make sure that we have it too. Other things that these are useful is that they give us kind of a roadmap. We have a good sense of what kind of information we're looking for. Our minds might start ticking if we need a CE, if there's something that we should be kind of on the lookout for. It helps to kind of have that at step one. And then finally, we like to have them early on because they can help us find hidden issues. For us, that means a doctor or clinic that you forgot to put on the application. You would not believe how many people do not list their primary care physician, but realistically, that's the person that you go to first whenever a problem comes up, and it's probably the doctor that you see most often over the course of a year. The other thing is sometimes people forget impairments because for them it's just who they are. Tanya kind of infamously had a claimant who applied because they were depressed. They went to the consultative exam because there wasn't a lot of information about this person in the file. And after the exam, Tanya's looking at the report and it notes that the person is blind. So she calls the person and said it was super awkward to say, excuse me, it says you're blind, are you? The person was, but having been born blind, that wasn't a disabling impairment for them. However, under Social Security's rules, that is a disabling impairment. So that person was actually able to be approved for benefits based on something that was just part of their everyday life. Other information that we are looking for includes functional information. I talked about the function report, but if you or your child works with a PCA, arms worker, if there's a specific teacher at school that knows your child really well or would be able to give us great information, list that somewhere on the application. This information can be really, really important, like I said, for getting that sort of everyday sense of how a person goes about life. And then finally, language needs and interpreters are always important. We want to make sure that we're communicating to the best of our ability in a way that you understand. If we call you up on the phone and you need an interpreter, we'll make sure that person is added. If you go to a consultative exam, we'll make sure there's an interpreter there. We have access to all sorts of different languages. I think Tanya and I have only been stumped once or twice trying to find someone to interpret. So that should be something we can definitely do. And if you are applying for a child or an adult child, but the parent or guardian speaks a language other than English, also let us know on the application. So if we have any further questions or you need to call us, we're prepared with the right language. Finally, if you have a child who has a speech and language disorder, there are certain times when an interpreter would be valuable at a consultative exam, and that's yet another reason to let us know about any other languages that are spoken at the home. A few things that you can do to actively help us while we're reviewing a claim is make sure that we're kept up to date about any changes. Make sure that we have your most current contact information, like your phone and address. We reach out to people pretty consistently. We have a question, we need an update, we're putting something in the mail with those function reports, they're sending you a consultative exam appointment information. We need to make sure you receive it. If we try to contact you by phone or we're sending you stuff by mail and there's no response, we can't get a hold of you, at some point we do have to close out the claim. So it's really important that you keep that up to date. If your situation is such that you don't have a reliable phone or address, it's okay. Give us someone else who would be able to take phone calls or receive mail and make sure that you get that information pretty quickly. So that could be a neighbor, a friend. If you are staying with someone temporarily, that is all okay. Just let us know. Basically, we're gluttons for information. The more we know about what's going on, the easier it is for us to process the claim. And then the other thing we want updates about is anything going on medically. If you have changes, if you go to a new doctor, if you've had special testing, all of this is information that we want for your decision, but we're not psychics and we don't know it happens unless you tell us about it. Most claims take on average about 5 months to process these days. Some are faster, some are slower, but that's kind of a ballpark average. If you think, what was going on with you back in like August, I assume a lot has changed. And especially if there is an impairment in your life that requires medical follow-up or further investigation, make sure that you're letting us know about changes as they come up. The other thing, if you can't tell it's important, because I said so, it's because I've mentioned it about 6 times. Make sure that you're filling in that activities of daily living form, that function report. Make sure that it is complete and do your best to go into detail. There are a lot of lines on the form for a reason. Putting in more than a 1 or 2 word response is helpful to us. The other thing is you can request the CADL, the collateral ADL function report, or send in additional comments. For a lot of people, specifically young adults, we'll send the form right to them, but a lot of people aren't able to fill them out very well. They don't have the ability to understand or the ability to write, or they might not have the insight into their impairments, especially for mental health. To provide sort of an accurate representation of what their daily life is like. And that's why it can be so valuable to have another person's input. And you are welcome to write it right on the form. You're welcome to request that secondary form, or you can send us a page with extra comments that you've typed or handwritten. We'll take it all. This is really important. As coincidence, Tanya and I both have dads who are on disability. My dad recently had his CDR come up. He was filling out this function report and he was filling it out in a way that I was like, this doesn't really describe you. He had a stroke and has a lot of cognitive problems and he can't use his hands. One of the questions is, do you cook? And he's like, oh yes, I love to cook. I cook every day. I consider myself a gourmand. And I'm thinking to myself, he can't actually cook. He can put stuff in the microwave and warm it up. He eats a lot of frozen food or oatmeal, yogurt, things like that. And so that was something where I wrote out my dad's exact answer and then I wrote from daughter and clarified what I actually observe him doing on his typical day. And then finally, anything that you can do to help with CEs is really important. We only order them because we think that they are necessary. We always try to make sure that they are located as close to your home address as possible. That is another reason that it's important for us to know your current contact information. If you've moved and you used to be in St. Paul, but you moved to Brainerd, that's a big trip. So make sure that we have your current place that you're living in the file. We also try to make sure that we are not asking you to travel too far, but some places there are big limits on how many doctors we have working for us. If you live, especially outstate, the metro area isn't so bad, but the nearest CE panelist might be 50, 60, 70 miles away. If that appointment is scheduled to be more than 50 miles away, we will pay some of the transportation costs after the CE, but other than that, transportation is up to you. If you are able to start planning ahead, making sure that your car is ready, you know your bus route, or ask a friend or family member for help, those are all great ideas. A lot of insurance companies will help coordinate transportation, as well as different state agencies that might be able to assist, like Disability Hub. I'll talk about them in a moment. Other things are notify the DDS examiner if for some reason you're unable to attend the exam. We're all real people with real lives. You might have a vacation scheduled and you're out of town. That is something that we will work our best to try to rearrange with you. We also know that sometimes you have other really important appointments. We'll do our best to work that out with you. If you get the letter and for whatever reason you say, I don't think I can go because of XYZ, or even if you think that the location is unusual or on a strange date. Some of our CE providers do exams on weekends or evenings. Let us know, we'll answer your questions, and if necessary, we'll talk about rescheduling the exam. And then finally, I just want to make sure that you know and use your resources. As I mentioned before, the DDS examiner working on your case is going to be an expert on the application by the time it's over. So call them and ask your questions. They should be able to give you status updates, make sure that no information is missing, collect changes to your address or medical situation, whatever the case may be. Every time we send a letter, and we do send a letter at the beginning of every claim, it will have your examiner's number and phone number in the bottom left-hand corner. So if you can see on the screen, excuse me, it says examiner 0030 and then a phone number 651-259-7751. That is a real person. I, Sarah, am examiner 0030, and if you dial that number, my phone is going to ring. Please don't do it right now. You do not have to go through a menu tree. You don't have to ask 16 people to be connected. It should go directly to that person or their voicemail. You'll get to talk to the examiner, or else they will call you back. You can also contact the local field office who took your application, but they are less able to give you up-to-the-minute updates if the claim is at DDS. Another great place to go is ssa.gov/disability. That's the disability portion of Social Security's website. As I mentioned before, it just has a ton of different information about all sorts of stuff that you might have questions on, probably stuff you don't have questions on. It can be a great resource for sort of answering those general things that come up through the application process. Another thing is that it's not available for all types of claims, and I am not 100% sure on the limitations because they keep updating this, but you can make a My Social Security account, which allows all of your information to be stored online. You log in and you can see all sorts of information like your claim status, if you're getting benefits, when they're going to be paid out, how much to expect your check to be. And then you do have to report some information back to Social Security if you're receiving benefits, and you can do that through the My Social Security account as well. So it's a really great tool if it's available to you. And then for any of you here today who are professionals who work with people who are applying for disability, if you're a case manager or social worker, there are a ton of pamphlets and brochures that are available online. If you go to ssa.gov/pubs, you'll find PDFs that you can download and print and share with any of your clients. Or if there are a few topics that come up again and again, you're also able to order paper copies of the publication and just keep them at your place of business. Keep in mind that other state and county social service agencies might have different benefits programs or options that would help you and your family. Check them out. We only deal with Social Security. A lot of people call us about the state medical review team SMART applications, and unfortunately we don't know anything about them. We are experts at Social Security, and that's about it. So if you think something else may be applicable to you, please contact that organization directly. However, Disability Hub, the organization I mentioned on the last slide, is a really wonderful resource that I can't talk about enough. They're run by the state of Minnesota, and you can contact them by calling 866-333-2466 or visiting them online at disabilityhubmn.org. They will take your call or connect with you online. There is no application process, no qualifiers other than you say you are a disabled person, and then they will find the right help for you. This can be for big things like how different benefits packages interact with each other, how different kinds of savings accounts or financial changes will impact your benefits. They might be able to help you find a new place to live if that's relevant. And they can also help with sort of simple everyday things. One of my personal favorite stories was they had a disabled woman with a diabetic cat, and she was having problems affording medicine for her cat, but Disability Hub was able to help find a resource to get insulin for her cat, to make sure that she had her friend and her cat was healthy. So they are really amazing for all sorts of different things, and I definitely recommend reaching out to them for any needs related to disability impairments or figuring out things to make your life a little easier. And then finally, you've got Tanya and me. I have, and I'm sure it's really hard to see here, but I'm okay, Judy and Jamie, if you want to share this, and it will be in the slide presentation that you're able to access. But you are able to email us at ch.mn.s26b.medical.relations.officers@ssa.gov. This email address will come to both Tanya and me at the same time. That means you've got eyeballs on it a little bit faster, and we're hopefully working to get you a response just that much quicker. However, you are able to reach out to us individually. I've got both of our emails here for myself, Sarah, and Tanya. Just make sure that when you email us, you are not including personal information like social security number, date of birth, etc. We want to make sure that your information is kept secure. While we know that our email system is super secure, anything that goes out to other email addresses or comes from them might not be. So we want to make sure that your data is protected. If there's something that is specific to you where we have to know Social Security or the specific applicant, we'll give you a call and we'll talk about it on the phone and research your answer and get it to you as best we can. I know myself, I am someone who I listen to all the information. Yep, this sounds great. I got it. And then 6 or 12 hours later, I go, oh, why didn't I ask that? So write these email addresses down and feel free to contact us if you have a question in a day or a week, or you send your application in next year and something is not quite making sense. Feel free to reach out to us. That is what we do. And again, you can also reach out to Pacer and we will try to get questions answered that way.
A special thanks to Sarah and Tanya, who are medical relations officers from the Minnesota Disability Determination Services. More resources are located at pacer.org. Pacer Center is here to help. Contact us using the email transition@pacer.org or pacer@pacer.org, or the phone number 952-838-9000. Also, check out our website at pacer.org/transition.